Welcome to Shruti Outloud, a podcast where I invite guests from different walks of life to share their stories of following their passion, success, and happiness, which in turn motivates our listeners to follow their heart.
Hello everyone, I am Dr. Gautam Banga and I'm a reconstructive urologist and neurologist working in Delhi NCR. It's really nice talking to all of you, and today we are going to discuss about something which is common but not very much discussed, and it's one of the most common congenital deformity which is seen in male children, male newborn male, and that is known as hypospadias. So the first question which we are going to, I'm going to answer is, what is hypospadia and how does it differ from other male congenital abnormalities? So as I said earlier, that hypospadia is the most common congenital deformity found in male child, and the ratio is somewhere around 1 in every 250 newborn male will have some degree, some kind of hypospadias. So hypospadias is a congenital deformity which affects the penis, the skin around the penis, and in certain cases, a severe form of hypospadias, the penis will be bent downward, and which is known as cordy, and it can also affect the testes. Sometime with the severe form of hypospadias, one or both the testes are absent. That means it is not present at its normal usual place, and they are located either in the lower part of the abdomen or they don't exist. And it differs from male congenital other genital abnormalities because this is a congenital problem. And the moment a child is born, a male child is born, it can be diagnosed and it should be corrected as early as possible. Means normally in my hospital, in my clinic, I take up a child for surgery even at the age of 1 year. So hypospadias is pretty common, and it's easily any pediatrician, any urologist can diagnose that. So the second question which has come up is, how is hypospadias typically diagnosed, and what are some of the signs and symptoms that might indicate its presence? So again, since it's from the birth, so if the delivery or the birth has taken place in a big hospital, the child is always attended by a pediatrician who examines the child completely and also check the genitals. So he's the first person who will inform you that the child is having a hypospadias. He can also tell you the type of the hypospadias, or he will tell you to consult a reconstructive urologist or a urologist who can actually help you with the exact kind of hypospadias and how it can be managed. So most of the time it's diagnosed on the clinical examination, which was done at the time of birth or immediately after birth, or sometime when you take the child for his first pediatric checkup, and then the doctor inform you about the hypospadias. But in many cases, because we see a patient from the age of few months, like infants, even up to 35 years old, having hypospadias. So these are the people who have been either ignored or neglected, or the education level were not good, or they had a birth in some village and done by some dai or healthcare worker, and so this thing was not taken care of or not even brought to notice of the parents, and many of them also not able to get the treatment because of financial reasons, and then they come either in their adolescent or in their adulthood, early adulthood, when they are planning to start their sexual life, or when they are planning to get married, or when they go for some military or police entrance exam, and when the medical is done, then they come to know that they have some degree of hypospadias. So an adult child will present with a urethral opening. The opening of the urine pipe will not be at the normal position, and if this is the penis, so the in spite of opening having here, the opening will be somewhere down the line from the top to the bottom. It can be at any place, and accordingly we decide whether it's a mild, moderate, or a severe kind of hypospadias. So along with that, the penis will be bent downward. In a mild variety, it will be like this. In a moderate, can be like this. In a severe, it will be totally downwards with a opening somewhere here, and it's all there's a thick skin bridge or band which is actually holding the penis downward. So a patient will have difficulty in passing urine in a standing position, and when the penis get erected, the penis is not straight. So these are the main ways a person can come to know that they have something unusual or not normal, and then they can come to us, and we can do the further investigation, examination, and we can talk about it. So third question which has come up is what are some of the potential complications that can arise from hypospadias both in childhood and later in life? So as I said that the hypospadias is of various types. So if it's a mild variant, it will not cause much of problem. But yes, cosmetically the penis will not be the normal as compared to the other children. So in childhood, the problem that patient can face or the complication the patient can face is that if the testes are undescended, that is, the testes are not in the same position along with the hypospadias, it should be brought down as early as possible. Otherwise, the function of the testes can get affected. If the penis is downward, the child will have difficulty in passing urine in a standing position, and most of the time he will be using a washroom and in a sitting position, which is quite embarrassing for the child. And once the child become aware of the surrounding, in the sense when they start playing and then they use the same washroom or they go for swimming, and sometime while in the changing room they discuss about the things, and if the child feel that he's having something abnormal, it can lead to some kind of depression, or suddenly the child start avoiding public gatherings or this common room stuff. And so that can bring a lot of changes in him. He'll try to be stay alone most of the time, not able to interact with his classmates or his fellow children. So more important is that we should talk to the child if he's facing some kind of issue in passing urine, or if he feels something abnormal, he should talk to his parent, and the parent should also talk to the child about that. In the later life, the most common problem a person can face is difficulty in doing the sexual act, because if the penis is downward, he'll not be able to do a routine sexual activity. The partner will have some pain or not comfortable with the act. Uh, it can also lead to infertility if the opening is very low. Then even after a normal sexual act, or even after a sort of a normal sexual act, the semen will stay outside, and so the for infertility can come in. The partner as well as the patient will have difficulty in having a normal pregnancy and fathering a child. Oh, so the next question is very relevant, and most of my patient parents always question me that can hypospadias be prevented, and if so, are there any steps that the parent can take to reduce their child risk of developing it? So many of the parents who have the first child having a hypospadias, they question me that doctor, what actually went wrong? What is the cause of this deformity? And if we go for the second pregnancy, and if it's again going to be a male child, is he going to have the same problem which my first child is having? So yes, hypospadias have some element of congenital transformation, like it can move in generations. And also, if you have one child with hypospadia, there is always a possibility that the second male child will can have a hypospadias, but it's not 100%. So if first child is male child having a hypospadias, it's not necessarily that the second male child will have hypospadias, but the possibility or probability is more compared to a normal pregnancy. It's a congenital deformity, so it cannot be prevented. But yes, if you have somebody in your previous generation having hypospadias, then you should be aware of that it can come up in your generation or in next generation. And but we cannot actually stop it. We cannot stop the genetic transmission. If there is some genetic element involved, we cannot stop it. But yes, we can be better prepared. We can be better prepared mentally, as well as we should have knowledge about the things. And so if we know the things, we can treat it earlier, and so the child will not come to know that he had this problem at the time of birth or in the early childhood. and he can live a normal life. So as such, as a doctor also, we cannot prevent it. As a parent, you cannot prevent it. But yes, if somebody in your family have a hyposphere, there's always a possibility that your next generation will have, can have this problem, and so you should look out for that. So next question is, what is the long-term outlook for patients with hypospadias, and what they can expect in terms of quality of life and overall health? So, as I said, since it's a congenital deformity, it should be tackled as early as possible, say around 1.5 years to 2 years, 2.5 years before the child start his school life. So, if it is done very early, the child will never remember this surgery, or he will have a very faint idea about the surgery. And if the penis looks normal after the surgery, then they don't face any problem in the future life. They can have a normal growth, normal sexual activity, and they can father a child normally. So if the hypospadias surgery is done in the early childhood, the child lives a normal life, and most of the time the penile size is the same as same age group children will have. But yes, if it is done at a later age, say around 9 years or 13 years, the child will have that thing in their mind that some surgery have been done, and always that thing stays in their mind that their genitals were never were not normal earlier, and now they are close to normal. So it's better that it should be done earlier so that the child can live a normal life. If the hypospadias is corrected, rest of the life stays normal. They can have a good growth. They can have a normal interaction with people. They can live a normal married life, and I don't think they will face any problem. But yes, if the hypospadias is not corrected, then definitely they will face a lot of problem in their life related to sexual interaction, as well as interacting with um, females and other partners in the future life. So the next question which has come up is like how important it is for patients with hypospadias to receive care, ongoing care and monitoring, and what should they expect in terms of follow-up appointment and testing. So when a child comes to us, we after the examination we finalize the date of surgery. The surgery lasts from say 1 hour 30 minutes to 2.5 hours, because it's a microsurgical procedure done with a lot of skill, so it takes a lot of time. But the recovery is super smooth. The same day the child start taking his normal meals. Next day he can go for a small walk. Catheter with dressing will stay normally stays for say 10 to 12 days, and we have to change dressing 2 or 3 times during that 12 or 13 days period. But the child will never have any kind of pain, so they are very cooperative. And once the catheter and the dressing are out, the child can do all his routine work within 2 or 3 days of removal of the catheter. They can join their schools. They can start doing their normal routine activity, or even they can go for their play time after say 15-20 days of surgery. So normally we call a patient for a follow-up after 2 months to just to check how the healing is taking place. And if the wound has healed completely and the child is passing urine from the tip with a straight penis, we tell them not to come for frequent follow-ups. They can come up once the child growth starts taking place. That is somewhere around 6 or 7 years or 10 years, and then they can come for just a review. So once the hypospadias is corrected, it doesn't require very frequent follow-ups. But yes, in an adult, we have to see whether there is some residual curvature and whether he will require some kind of intervention in future to correct the curvature. We have to check the urine stream in an adult, because in adult the urethral lumen has to be of a bigger caliber, and so we do uroflowmetry, which is the way by which we can check the urine flow, and we advise it to be done every year after the surgery. And if it's static or stable for 2 or 3 years, then there is no need to come for any further follow-up until unless you need any kind of um, if you have any kind of issues or you need any further information regarding that. No. Again, the next question which has come up is that there any non-surgical treatment for hyperspadias such as hormone therapy or medication? So the answer is that it's a deformity. So if something is not normal, we have to bring it to normal or as close to as normal. So the only way we can do is to do the surgery and to correct the deformity and give the penis the normal looking shape, as well as uh, urine pipe should be constructed so that the patient can pass urine in a standing position. In certain cases, when the penile size is small in a child, we might give hormone therapy, that is in the form of testosterone gel or injection for 2 to 3 months, so that the penile size goes up a bit and the vascularity increases so that the healing is better. But it's not mandatory in all the patients, and if the penile size is decent enough, we can straight away go with the surgery without giving any kind of hormone supplement or hormone therapy. So the only way by which we can correct hypospadias is to do surgery. Earlier, the better. And yes, this you have to see with how much that center is actually doing, because it's a skill set. It's not something like a kidney stone which is done day in day out, and most of the urologists are doing. So there are very specific centers for hypospadias, and in our hospital, everything is very much streamlined. From the moment a child enter my OPD till the time he get discharged, or even when he come for the dressing, everything is very much streamlined. My staff is very much trained for that. My OT staff knows what kind of instruments are required, so I don't have to really rush from one place to another. Everything is very much streamlined. So these dedicated centers really makes a huge difference when it comes to results as well as the post of care. Parents. So next thing is whether how parents can actually help a child with hypospadias in giving the child physical emotional need. Parents really play a big part. Okay, so their parents are the one who actually take care of the child. We do our work. We keep the child for 2 days, but after that, everything is taken care of by the parents. And I'm telling you, parents are really helpful, and because of them, we are able to do around 20-25 hypospadias every month because of the parents' cooperation. So they sit with the child the whole day, so that there's no soiling of the dressing and the catheter is taken care of. So they are the main pillars of our hypospadias care, and even in the future, we always tell the parents to keep checking the urine flow and see how the wound is healing. And they always update me with videos and photographs, and they are really helpful. And yes, they have to counsel the child that though he was having a issue earlier, but that has been taken care of, and now everything is normal. These kids need reassurance every time and again that everything is normal, and they can just do whatever a normal child of the age group are doing. So children of same age group are doing. So you have to keep reassuring these children, these kids, and parents can do that because sometimes we are not available or we cannot give as much time as they need. So parents have to understand that they are the one who are actually going to put the children into a normalcy and a normal life. So, what advice would you give to someone who has been diagnosed with hypospadias or to their loved one who are seeking to support them? So, as I said, it's a congenital deformity, so nothing can actually change the things. We cannot go back and change the things. So, if a child is having a hypospadia, if adolescent is having a hypospadia, the first thing is to come for consultation to get themselves examined. The parent should bring their child, and if it's adolescent or an adult, they should come and meet a good reconstructive urologist. All aspect of treatment will be discussed. Proper examination is required in context with penile size, curvature, how much skin is there, and there are many patients who have been operated in the childhood, which the surgery have failed. So they need treatment. They need treatment. They cannot live with that failed surgery. So a lot of young male come to us with the failed hypospadias done at a rural setup or a small city, and so they need assurance that everything will be all right after the surgery. So once you're diagnosed with hypospadias or you come to know that you have hypospadias, don't panic, don't feel low, don't get depressed. Everything is correctable, everything is treatable. So consult us, consult any good reconstructive urologist, and then the treatment protocol starts, and we can take care of the things in a better way. So if you know somebody who is suffering from hypospadias and not willing to come, you can always talk to them. I'm always available for video consultation, any kind of video demonstration, and there are many testimonials, patient testimonials who can help you in understanding how they have gone through their journey of hypospadias correction. So never, don't feel depressed, don't isolate yourself from the society, or stop interacting with the opposite gender just because you have some issue. Within a month time, you can always have a normal looking genitals, and you can resume your, or you can start your sexual activity, say within 2 months of the procedure. So don't get depressed, don't feel shy, everything is treatable. So, how can society better promote awareness and understanding of hypospadias and reduce stigma and discrimination towards those who have the condition? So, if you compare the Indian society, yes, we still don't want to talk about genital deformities, and but in US or in European countries, there are various groups which actually promote awareness about the problems, and parents can always contact them. They provide them all the literature, photographs, how to take care of the child before, during, and after the procedure. So we have to have these kind of societies and groups in India. So I'm working on it. We are around 4 5 reconstructive urologists who are doing mainly dealing with this hypospadia. So we are connecting our all patients. We always request them to talk to our future, like the recent or the future patient. We always tell them to that we'll require your help to convince them about the surgery, to tell them how the benefit of surgery, and also to give them moral support by talking to them frequently. And the patient who are going undergoing the surgery can also talk to them. The parents can also talk to the previous patient or their parents, and this way actually everybody get bond together, though they're getting bonded because of the illness, but then they become friend, and then everything become very smooth between them. And so we need this group, and hopefully we'll have this kind of group in future to provide awareness about this, as well as to give support, emotional, as well as if they need some kind of financial support for the surgery, these kind of group can help them. So this was a brief overview about the hypospadias, how, what kind of problem a child or adolescent or adult can face with the hypospadias, how we are managing, and how things are managed everywhere around the world. So any kind of issue, you can always reach out to me, any of your loved one, or even if you are a young guy facing this problem of hypospadias, you can always reach out to me, or you can reach out to any reconstructive urologist in your city. Talk to them. Everything has a solution. You can only live a normal life with that after the surgery. And surgery is very, like, they're very result oriented, and if it is done at a good place with good post of care, it give very fantastic result. So hypospadias is not something which you have to live with. It is treatable, and so go ahead, get it corrected, and live a normal life. Thank you.
Shruti Out Loud welcomes all stories. It can be a brand, it can be an organization, or it can be a person. The only thing common would be passion for life. Please subscribe to this podcast on Spotify, Google Podcast, Apple Podcast, Amazon Music, Ghana Podcast, and every other platform where you can hear this. Please leave a review, as that helps my podcast to grow. Thank you once again. See you for the next